Now coming to aortic stenosis. Aortic stenosis is the most common cardiac valve lesion, particularly in elderly age group beyond the age of 70, and it also happens in high risk patient. Between 0 to 30 years, it is congenital aortic stenosis. Between 30 to 50 years, a congenital bicuspid aortic valve will be there, which can become stenotic between 30 to 50 years. Rheumatic etiology is more common between 30 to 60 years, and the degenerative aortic stenosis, which is the most common type, which will be greater than 60 years of age. Aortic stenosis is most often caused by congenital bicuspid valve, which is present in almost 1 to 2% of the population. It is one of the commonest congenital anomaly. This is bicuspid aortic valve, and this bicuspid aortic valve has an inheritance with autosomal dominant and variable penetrance. Patients with bicuspid aortic valve are asymptomatic until late in disease process, although severe symptomatic AS or AR develop in midlife. Up to 30 to 40 years, congenital bicuspid aortic stenosis won't give any symptom. But beyond that, the wear and tear of the bicuspid aortic valve will make the patient more symptomatic. Typical fish mouth or elliptical shape opening of the aortic valve in the mid-esophageal short axis view is a telltale sign of bicuspid aortic valve. Here you can see the fish mouth appearance. This is the aortic valve mid-esophageal short axis view. Here you can see the fish mouth appearance of the aortic valve, which is a classical sign of bicuspid aortic valve. So, your bicuspid aortic valve tend to open and close with abnormal folding and creasing. Normally, it is a tricuspid aortic valve. Aortic valve is tri-leaflet, but in case of bicuspid, it tends to open and close normally, but there is going to be abnormal folding and creasing. Imagine 2-3 leaflets are there. In that place, there is only 2 leaflets. So, there is going to be abnormal tension on that aortic valve, and this leads to scarring and calcification, which culminates in aortic stenosis with or without regurgitation. This is congenital. By 30 to 40 years, they might have some wear and tear of the valve and develop aortic stenosis. Another important thing is this bileaflet may have some abnormal motion also. Instead of trileaflet, it is bileaflet. Although sometimes they might have abnormal motion which causes turbulent flow into the aorta, which can lead to dilatation and subsequent rupture and dissection. So, a normal bicuspid aortic valve can have abnormal folding and creasing leading to aortic stenosis, or an abnormal motion of the bicuspid valve can cause turbulent flow leading to dilatation and dissection. Acquired aortic stenosis is usually the result of senile degeneration with sclerosis and calcification of the valve. The entire blood from the left ventricle has to go across the aortic valve. Imagine up to 70 years of old age, the entire blood from the LV is going through the aorta throughout your lifetime. So, this aortic valve is bound to have some wear and tear. So, it might be a senile degeneration. Approximately 3% of the patient over 75 years have aortic stenosis, and what is more important is 12% will have moderate to severe aortic stenosis. There is a clear association between clinical risk factor for atherosclerosis and aortic stenosis. Whenever there is going to be some calcium deposition in various vascular disease, there is some association with aortic stenosis. In developed country, rheumatic disease is less common cause for AS and AR, and in case it is rheumatic, the AS is usually associated with concomitant aortic regurgitation.